join us. Thanks for your patience. Okay, we still may have a few people joining us remotely, but in the interest of time, let's go ahead and get started. First, let me say again, good afternoon. We're very happy that you've joined us today for a presentation of findings from the Midline study of the Ifaa Resilience Food Security activity implemented by Catholic Relief Services in Ethiopia. My name is Tom Spangler, and I work with Save the Children as Activity Director for the IMPEL Associate Award. I'll ask Terry to paste a link in the chat box to a 2-page brief that provides a bit more detailed information on our activities. Many of you, if not most, will already know that the purpose of IMPEL is to conduct both performance and impact evaluations and facilitate knowledge sharing to improve the design and implementation of BHA-funded resilience food security activities. Today's presentation will be led by Causal Design. Causal Design is among IMPEL's 5 research partners and has extensive experience in designing and conducting rigorous research on food and livelihood security programming throughout sub-Saharan Africa, including previous research for BHA. I'll pass it first to Rigsam Wangchuk of the Causal Design team, who will be leading the presentation today. Rigsam may be joined by Miguel Uribe as needed to help respond to questions about the Midline study.
Great.
In addition to sharing findings, Causal Design will give an overview of Ifaa interventions and methodology used in the Midline study. They'll also be responding to any questions you may have about the findings at the end of their presentation. But for those of you who may have questions during the presentation, we ask that you use the Q&A function on the bottom of your screen to enter your question so that we can efficiently answer as many as possible. Now, we will save time at the end for questions. I know that Causal Design has a full presentation today. Any questions that we're unable to get to today, rest assured we will respond to them likely in writing and follow up to today's presentation. Finally, today's presentation and Q&A will be recorded, but only for IMPEL and BHA reference, and the recording will not be shared publicly. So with that, we thank you again for joining us, and I'll pass it off to Rigsam to get us started. Over to you, Rigsam.
Great. Thank you so much, Tom. Good afternoon, everyone. My name is Rigsam Wangchuk, and I work as an economist at Causal Design. And I'm joined by Miguel, who's also a principal investigator for the study, for the Ifaa impact evaluation study. So we're very excited to be presenting our findings from the midline evaluation that we conducted this year. So to give you a quick overview of the agenda, so we're first going to go over what happened during midline. So this includes the objectives, stakeholders of the general impact evaluation and program context, report primer, evaluation design, and then specifically what happened during data collection at midline. This is going to be followed by high-level findings by theme, and we've integrated field contextualization based on the implementing partner workshop that we conducted at the end of August. And as Tom said, we're going to save the bulk of questions and answers for towards the end. So if you have specific questions during the presentation, please post them in the chat as Tom instructed. And then I think Miguel will be taking on the questions and collating them. Great. So the objective of this meeting is to present the Ifaa midline findings from the Ethiopia RIPSA. We hope that this presentation will give the stakeholders a better understanding of the midline findings and will help inform the programming of the Ifaa RIPSA. We're expecting the stakeholders to be present USAID BHA as well as IMPEL. To give you a quick overview of the Ifaa program context, the Ifaa RIPSA aims to improve the food security of vulnerable households in the targeted PSNP communities in Ethiopia's Oromia region. And this is expected to contribute to a sustained reduction in rural poverty. The evaluation will compare outcomes in the treatment kabeles receiving the Ifaa enhanced package to those same outcomes in the control kabeles that only receive the PSNP basic package. The study is also a little more complicated because we also have a livelihood and non-livelihood disaggregation. And this was primarily driven by CRS's implementation plan before the design for the impact evaluation was even conceived. So we at Causal Design were able to define an impact evaluation design within the setup of a livelihood, non-livelihood area. And for this impact evaluation specifically, we have 4 groups, as you see on the screen here. So we have a control treatment and then livelihood, non-livelihood. So what I do want to point out here is that in the livelihood areas, the kabeles would get the agriculture and economic livelihoods interventions. And in the next slide, I will show this illustratively. So CRS purposefully selected about half the kabeles to be part of the study to be in livelihood interventions. And the half would not receive the livelihood intervention, so they were the non-livelihood kabeles. So in these 4 categories, the control group gets the PSNP basic, and the the treatment gets the Ifaa enhanced, and within those packages, livelihood areas get the agriculture and econ livelihood interventions, while the non-livelihoods don't get any of the agriculture and econ livelihoods interventions. We've also provided some background information on the criteria CRS used to determine which kabeles should be livelihood versus non-livelihood. Now to show you illustratively, so CRS basically had groups, intervention family groups. So as you see, I've only segregated the agriculture and economic livelihood group of interventions here. So as you see on the 9 non-livelihood columns, like there are none. That means that they're not receiving any of these interventions. Now within the livelihood, the first column, PSNP basic, that's the control interventions. So they receive some of these interventions, while the Ifaa enhanced package, which is the treatment, they receive all of these interventions. So I just wanted to make sure that everybody was aware of what actually is happening in the background when CRS is implementing livelihood, non-livelihood control treatment packages of interventions. Great. So for the overall impact evaluation, we decided to go with a cluster randomized controlled trial approach, with the clusters being cabeles. So the control group has 50 cabeles, translating to roughly 1,950 households, and the treatment group has about 70 cabeles, translating to roughly 2,730 households. So we've tried to make this clear in this diagram. So you see livelihood, non-livelihood, like 60-60. In total, we had 120 cabeles, and you can see the disaggregation within those livelihoods, livelihood, non-livelihood cabeles. Now, for the midline activity, so the midline survey is actually a part of 4 activities that is planned to be carried out as part of the overall impact evaluation study. So the baseline was conducted in 2022, the process evaluation was conducted last year, and the midline was conducted earlier this year. So the midline survey is basically a progress assessment conducted roughly 2 years after the baseline. It is effectively a smaller version of the baseline survey, both in terms of sample and the survey length. The intention is to, to use quantitative methods to measure what's happening with regards to the indicators. We also wanted to check on attrition rates, so we are better prepared for inline and to understand how communities are dealing with shocks and stresses. And then the third purpose for the midline survey was also to provide data to support CRS with some of their programming decisions. And then finally, we also wanted to use the midline as an opportunity to provide context for the remaining activities. I'm not gonna talk too much about the other activities, since today's focus is just on the midline. So at midline, as I mentioned earlier, the households sampled were a subsample of households that were sampled at baseline. The midline sample was about 1,259 households, out of which 749 were treatment households and 508 were control households. We tried to mimic basically the proportion of sampling of done at baseline. So the midline also didn't fully repeat the baseline. For example, we left out the anthropometric measurements, the agricultural yields, household consumption, and also the children level outcomes. And we also did not include the high-level resilience indicators. The indicator selection for midline was done in consultation with both CRS and BHA. So in terms of the randomization approach, so out of the 120 cabeles selected for the whole impact evaluation, we only went with 84 cabeles at midline, due to budget and time constraints. Out of the 84, 42 were livelihood cabeles and 42 were non-livelihood. And within that, within these each of these livelihood streams, 17 were control cabeles and 25 were treatment cabeles. So for the midline randomization approach, basically we relied on baseline data that was collected May to July 2 years ago. So using the baseline data, we surveyed a subsample of households. From that sampling frame, we selected randomly selected 84 cabeles, and within each cabele, we randomly selected 15 households, and that was basically our sampling strategy. So at the end of it, we arrived at 1,259 households, which agreed with our budget and our work plan that was assigned for the Midline study. So moving on to the actual high-level findings. So before we begin, we did want to just set up some ground rules on how to interpret the results, because we have a lot of graphs and numbers that are coming up. So we just want to make sure that, I know it's like after lunch, people might be getting, it might be harder to like pay attention. So we just want to make sure that we equip you best to be able to process these numbers that we're going to be throwing at you. So just a reminder that differences in average values between treatment and control are informative, but sometimes they can be misleading. So we always try to make sure that differences in averages are tested for statistical significance. So these are the little stars, the 1, 2, 3 stars that economists really care about. Percentage points versus percentage change is another area that we are careful about. So for example, say the treatment mean is 12% and the control mean is 10%. So how we interpret this is that it is a 2 percentage point increase, rather a 2% change. This is because if you actually calculate the percentage change, it's actually a 20 percentage percent change increase. But when we look at differences in proportions, we care about the percentage points. So that's something that we wanted you to be careful about when interpreting the results. And then finally, we can say if a change is we can say that if a change is statistically significant and therefore a result of the program activities, but we can't say whether it is a good outcome or a meaningful outcome because of the efforts or the money spent on it. A couple of field contextualization points that we also wanted to bring to your attention before starting is that during the baseline, the area was actually going through a pretty severe drought. And although like some of the drought conditions have improved a bit when we were collecting midline data, while talking to CRS, we also found out that some of their implementation timelines and strategies had to be adjusted for some of the interventions because of drought that the households were experiencing at baseline. So we will bring this contextualization where relevant when presenting the results. And then we spent a lot of time talking about livelihood and non-livelihood in the previous few slides. So we do disaggregate by livelihood status some of the results, but the disaggregation is going to be based on whether the agriculture and economic livelihood interventions actually were directly related to the outcome group or not. For example, for the food security outcomes like women's dietary diversity, agriculture, gender dynamics, and some of the participation modules, we will disaggregate, we will be presenting disaggregated results by livelihood, non-livelihood. But for some of the interventions like WASH, which was given to both livelihood and non-livelihood cabeles, we don't disaggregate it by the livelihood status. Okay, so without further ado, here come the results. So we'll first start with food security and agriculture. Just to give you a very brief summary of what we found. So we didn't find any any difference between treatment and control in terms of food insecurity measured by FIES. However, we did see a large difference between treatment and control, but only in the livelihood areas for dietary diversity measured by the food consumption score. We do want to highlight that FIES and FCS have differing time sensitivities. For example, like FCS reflects more of the short-term changes in diet, while FIES is more closely tied to perceptions of food security, including both like psychological as well as social factors. And these perceptions tend to change a bit more slowly over time compared to FCS. For the agriculture group of outcomes, we found that the farmers are still prioritizing consumption over value chain engagement. Farmers also tend to prioritize livestock over crop as a value chain activity. We did see large changes in terms of adoption for livestock, particularly for goats and poultry. And then we didn't see much difference between treatment and control in terms of the financial service usage across both the livelihood and non-livelihood areas. So starting with food security, the results are going to be disaggregated by livelihood status because this is directly related to the livelihood interventions. So what we're going to present is, so what we looked into at Midline were the FIES, prevalence of food security, and FCS as indicators. I'm not, Miguel, do I need to talk about how these were constructed, or can I assume everyone knows?
You can just keep going, Rigsum.
Great,
Yeah,
thanks
I
so much,
can.
Mara.
If anyone has like specific questions, I can answer them directly in the chat. But yeah, we don't want to spend too much time talking about
Perfect.
this thing.
Yeah, I'm a little bit mindful. Thanks, Mara. Thanks, Miguel. So for FIES, basically, as I said, no statistical significance between treatment and control. We saw that overall the households are still experiencing some level of food insecurity. As you can see, like the severe food insecurity levels average at around 46% across all the areas, all these groups, while the prevalence of moderate and severe food security hover around almost 73, 75% across all areas. So the FIE scale is constructed by adding up questions to about answers to about 8 food insecurity related questions. So what we think after talking to CRS is that the reason why we're not seeing any treatment effects is because it's likely tied to like food related covariate shocks or stresses that the region experiences overall. For example, households tend to, because of the Oromia region, like droughts and food prices are something that affect the whole region systematically and uniformly. So we think that that might be the reason why we're not seeing any treatment effects. But we can explore more of the shocks and stresses in the resilience section that's coming up. So the impact of on the food consumption score, as you can see here, you can only you see a large and a statistically significant impact only in the livelihood areas. And what this tells us is that the agriculture and economic livelihoods component of the Ifaa enhanced package, which was given only to the treatment households in the livelihood areas, we think that that might be contributing to the improvement in the household dietary diversity as measured by food consumption score. And we find that on average across all areas, food consumption score is moderately high. 3 in every 5 households say that they have acceptable food consumption score. Moving on to agriculture, this is also disaggregated by livelihood status, and we're going to talk a little bit about how the sample for this module was done, and then we'll go over value chain activities, the target crops and livestock that CRS targeted. We'll move on to improved management practices, and then lastly, we'll talk about financial services in this section. So the sample for this for the agriculture module required us to purposely select a responsible lead farmer who's about 15 years or older, and they present knowledge about they had to be present in the household and they were knowledgeable about agriculture production in the household. We do want to highlight that some of the indicators on agriculture are limited to only farmers that sell or resell their produce or livestock to earn an income. So the first indicator that we wanted to share with you is the one regarding value chain engagement. So we find that farmers are still prioritizing consumption over value chain engagement. So across the midline sample, about 99% of the households said they had at least one farmer in their household, but we find that only 19% of the households actually cultivate any crop or raise livestock for the specific intention to sell or resell to be able to earn an income. Among farmers that do grow or raise livestock with the specific intention to sell or resell, we see that the farmers in the livelihood cabeles are about 22 percentage points more likely to use a value chain activity. And then we don't really see a treatment effect in the non-livelihood areas, meaning that there are no stars. I do want to highlight that, again, because there are only about 19% of the households that engage in a value chain activity, this whole sample here is only about 231 households. And then I also wanted to highlight that the market this could be a result of the market interventions that are implemented exclusively in the treatment livelihood cabeles. And so that's probably what's driving this impact here. Okay. The next takeaway that I want you to take from the slide here is that the first row here are just crops, and then the second row here are livestock. And what's pretty obvious here is that you see more colors and larger column sizes for the livestock. So it seems that households are going for more livestock related value chain activities as opposed to crops. Based on our discussion with CRS, what we found out is that this is part of the on-farm livelihood pathway, and basically households are self-selecting themselves into livestock husbandry or and then for the crops, so what CRS was saying was most likely households are selecting livestock over crops because using crops for value chain is pretty, it's limited by a farmer's land holding in that particular region. And the other reason is that I think for hardcoat beans, it can only be grown in only some areas. What CRS was also saying was that goats tend to be more popular because I think certain species are considered more drought resilient. And then because of the drought in 2022, severe drought in 2022, the government of Ethiopia as well as CRS is not promoting ox. as a source of livelihood. So the next few sections, we're only going to be focusing on potato because this is where we do see more engagement, and then goats and poultry. And we're not going to talk about the haricot beans, groundnuts, and ox. So what we're seeing is amongst the crops, popular potatoes seem to be popular, and this is according to CRS. They see gaining more popularity among the agro-pastoral communities for reasons such as their short growing seasons, which also make them suitable for more fluctuating rainfall patterns. We see a treatment effect only in livelihood areas, and we think it's likely due to the market and financial interventions offered exclusively to the treatment group in the livelihood areas as part of Ifaa Enhanced Agriculture and Economic Livelihoods package. We don't really see any treatment effects in for the practice of improved management practices, and this is because technical training is provided to everyone in the livelihood areas, whoever self-select themselves for potato growing. So we don't really expect to see any treatment effect, but we are also seeing some high prevalence rate in terms of use of improved management practices for potatoes in the non-livelihood areas, and we're not really sure why. And this is something that we'd like to look more into at Endline. Okay. So for the livestock, we see very large take-up of goats and poultry only in the livelihood areas. As you see for goats, it's almost a 20 percentage points difference between the treatment and control. And for poultry, it's almost a 17 percentage points difference between treatment and control. And the treatment effect is only in livelihood areas, again, for the same reasons as potatoes. This could be because of the market and financial interventions that are only offered to the treatment group in livelihood areas. And then similar to the last slide, technical training is provided to anyone who self-select themselves into this livelihood pathway. So we don't really expect to see any difference between treatment and control. So there are no stars. But again, we do see like high prevalence in terms of use of improved management practices for goats and poultry in the non-livelihood areas. And we're not really sure why. And this is also something that we would like to learn more about at Endline or collect more data. So I think the story on the financial services is something that also took us a while to understand, and Sarah's is really helpful. So basically the financial services for farmers, the use of it was constructed based on three components: savings, agriculture credit, and insurance. But we found that the use of financial services is actually primarily driven by savings. I think credit as well as insurance weren't used as much, so we're only going to focus on savings, which is the graph on the bottom left. So the contextual piece here is that basically everyone gets group-based savings and lending programs. So this should be in livelihood, non-livelihood areas. However, within the livelihood areas, everyone gets the group-based saving lendings program, plus additional savings-related financial interventions. So this could include like linkages to formal financial institutions or credit guarantee, etc. So we don't really expect to see much of a difference between treatment and control because this is very savings driven. And then although the treatment areas within the livelihood areas are getting some extra interventions around credit and insurance, they don't really seem to be having an effect right now. So we don't see a treatment effect. So within the non-livelihood areas, here's where it gets a bit interesting. So everyone only gets the group-based savings and lendings program. And we see a pretty large treatment effect, almost like 16 percentage points difference in terms of financial services use, and then almost 25 percentage points difference in terms of those who saved. So CRS thinks it might be due to delays in terms of a group formation for these savings lending program in the control areas. So that's something that they're going to try to expedite in the upcoming implementation plans. I think the biggest takeaway that we want you to take from this slide is that it seems that the group-based savings and lendings program is what's driving savings and therefore what's driving use of financial services. Great. We're like running tight on time. So let's move on to women's health and maternal care. Just high-level summaries. So the difference between treatment and control in terms of women's dietary diversity is pronounced and statistically significant only in livelihood eligible Quebeles. So we don't see it in the non-livelihood areas. And for the maternal care indicators that we looked at Midline, we didn't really find any impact. And then generally, like less than a third of women received more than 4 antenatal care visits, and then less than 5% received more than 4 postnatal care visits. So for this section, we looked into overall like 3 categories of outcomes. So the first one is the minimum dietary diversity for women. This one we're presenting disaggregated by livelihood because this relates to women's food security, which is directly relates to the livelihood interventions. And for the maternal care, we looked at antenatal and postnatal care. For the maternal care, we do not disaggregate it by the livelihood status because the livelihood interventions don't directly affect maternal care outcomes that we measured at Midline. And for the maternal care questions, we only asked questions to women who had given birth in the last 5 years. Okay. So similar to the household dietary diversity measured by the food consumption score, we also see a treatment effect for women's dietary diversity only in the livelihood disaggregation. And we see a treatment effect of about 17 percentage points, which is pretty large. And this is driven by consumption of dark leafy, green leafy vegetables, vitamin A-rich fruits and vegetables, dairy, eggs, meat, poultry, and fish. So we think whatever the livelihood interventions are doing, they're doing a great job. And this would be the livelihood interventions that I showed earlier at the beginning of the presentation. So these would be the agriculture econ livelihood interventions that are part of the Ifaa enhanced package. Okay, so in the maternal care, as I mentioned earlier, we don't really see any treatment effect yet. And I do want to emphasize the yet because we think there are a couple of potential factors. So everyone receives the government of Ethiopia's basic health extension programs. And then through CRS, the treatment areas received additional training from the health extension workers. But then this revised programming strategy was only implemented around December of last year. And since we started collecting the midline data around May, this only gave about like 6 months for that exposure of that strategy to take place. And then within that 6 months, there weren't that many women who gave birth. So it's a very small sample size. However, by end-line, we hope that enough time would have elapsed and enough women who are giving birth between now and end-line would have experienced this intervention, and we'd be able to see some impact by end-line. Okay. All right. So this is going to be a slightly meaty section on WASH and gender dynamics. Just quick high-level findings. So for WASH, we did observe significant impact in the treatment areas with regards to treatment of drinking water, hand washing, as well as reduction in open defecation. For the gender dynamics, we didn't find any major difference between treatment and control. This is regarding like cash earning and decision-making within households, within couples, as well as to access to credit and decision-making around borrowing within couples. So starting with WASH, the results are not disaggregated by livelihood status because the WASH interventions were not disaggregated by livelihood status. And for Midline, we focus on the basic drinking water services, water treatment technology, hand washing, open defecation, and the basic sanitation services indicators. So at Midline, we don't really see any improvement, any difference between the treatment and control for improved water source. And this is because CRS sees water infrastructure development as a basic service that should be provided to everyone. As such, we don't really see any treatment effect, except for this one here at the bottom right, which is the per capita volume of water that a household draws every day. This is in liters. So CRS thinks this could be possibly due to some implementation delays, but by end-line, CRS does not see any difference. CRS does not expect any difference between treatment and control by end-line. On use of water treatment technology, this was where CRS provided a lot of interventions in the treatment areas only, so they did expect to see large differences, and as such, we do see a pretty large difference between treatment and control, roughly about 17 percentage points. And this is because CRS promoted especially low resource options, such as boiling and bleach or chlorine in the treatment areas. Because of the drought, they couldn't really start some of the market-related interventions that would have made filtration and flocculation more accessible to households. So they're going to start the implementation in year 3. So that should be, I think, next year. So by end-line, hopefully we'll get to see some impact for filtration and flocculation as well. Okay. So for hand washing, we see a pretty large impact of about 11 percentage points. Hand washing is primarily driven by availability of water, which is what I was saying earlier about the water infrastructure development that's provided to everyone. And then use of ash as a soap agent. CRS did say that they were having soap shortages in the market, so they had to focus on a lot of the social behavioral change campaigns to get people to start using ash, and it seems to be working.
Rachel, I'm sorry to interrupt, just chiming in here to note that we have about 15 minutes left. So if we're to leave any time for questions, we'll need to wrap
Sure.
soon.
Thank you. I'll try to just focus on the high levels then. Thanks, Tom. So for open defecation, we see a pretty large reduction in the treatment areas, and CRS thinks we think it's due to the SBC campaigns that CRS conducted, as well as additional interventions that focus specifically on reducing open defecation that was only done in the treatment areas. For BL27, using improved sanitation facilities, there isn't a treatment effect yet at midline, but as market-based activities start in year 3 and more sanitation-related products become available, we expect to see end-line results impact by end-line. For the gender dynamics, the results are disaggregated by livelihood status as it pertains to earning cash, which is directly affected by the livelihood interventions. And we looked into cash earning, access to credit, and financial decision making. I'll be pretty quick on this one. So for cash earning, we don't really see any treatment effect across all the 3 indicators that we collected. I do want to highlight that there are 3 livelihood pathways that CRS focused on-farm, off-farm, and wage employment, of which we know that for the on-farm pathways, as we discussed earlier, households are prioritizing consumption over income. So that might be the reason why there's not much cash earning happening and we're not really seeing anything. And for the off-farm and wage employment, we're really not sure what's happening, and that's an area that we would like to collect more data on at Endline. And then we also see a gender disparity, that there are more cash-earning men than women, but this is expected given the context of the region. We don't really see any difference in decision-making, so I'm just gonna like skip this slide, but again, I think the highlight is that there are not that many people that that are earning cash. In terms of access of credit, no difference between treatment effect. And again, this is likely driven by the group-based savings and lending programs that is implemented everywhere. Yeah, and I think we spoke about this a bit earlier too. It seems that the linkage of formal financial institutions and the credit guarantee scheme that's only offered to the treatment group within the livelihood cabeles, it doesn't seem to be making a difference. Okay. And then regards to decision making, for borrowing, we also don't see any difference between treatment and control. Okay. I'm just going to quickly glean over resilience and participation, and then maybe park the participation bit so we can answer questions. Just to give you a quick overview, no treatment effect on most of the resilience indicators. And then for the participation module, we found that the participants seem to be pretty confused about what constitutes as risk interventions. And then participation rates in most of the interventions are in line with CRS's implementation plan. So for resilience, we didn't disaggregate by livelihood, and we focused on 3 high-level indicators, four high-level indicators, specifically ability to recover from shocks and stresses, local government responsiveness, household level social capital, and then participation in group-based savings program. Just quickly, no treatment effect because no treatment effect because the shocks that the households were experiencing are covariate and systematic. And then, as I mentioned earlier, we also know that there has been some improvement in drought conditions since baseline. In terms of government responsiveness, no difference. This indicator is based on security and police force that's provided by local government, as well as conflict resolution committee in the village. Given the context in Ethiopia right now, CRS thinks that maybe the government responsiveness indicator should be reconsidered and limited only to agriculture and health interventions. And then social capital, again, no difference between treatment and control. Bonding social capital is slightly higher than bridging. And what we find is that this index varies pretty significantly across the 8 worredas, so it's very worreda specific. And then for the savings programs, the treatment group is about 13 percentage points more likely to participate in group-based savings. We've mentioned this many times during the past hour, but this was not expected because the group-based savings, lending savings program is provided to everyone. So CRS thinks it probably is due to group formation delays in control areas, especially in the non-livelihood areas. So I'm actually going to pause here because I know we only have 8 minutes. We have more slides for participation, but I think we've covered the major ACO modules from Midline.
Okay, thank you very much, Rixum. I've seen that a couple of questions have been entered and responded to in the Q&A tab. Thank you, Miguel, for that. Let's take a moment to see if anyone would like to come off mute and state any observations or any other questions. If there are none, maybe we can continue with the participation findings. Any questions or relevant points to add in response to what causal design has shared thus far? If so, please raise your hand or just come off mute and ask your question.
Hi, thank you for.
Hi, Jean-Paul. Yes, please go ahead.
Thank you for this presentation, and that might be not relevant for this audience, but just I have my question is about the sort of the value of the midline, or your comments on that, given that it has a smaller sample and what it's able to tell us compared to what you might want to see at endline. And relatedly, but that might be parking lot, is about what the midline was able to tell you about attrition. That is relevant for endline.
Miguel, do you want to answer this now, or?
Yeah, I can go ahead. So yeah, effectively the midline was a smaller sample. I mean, by construction, it was designed like that. But nonetheless, we also focused on a lot of variables for which like we would have enough information, and we ran like power calculations. Now, the results that you have seen, we have already seen a series of areas where we are seeing results, and the contextualization additionally that we did with CRS has given us some signs of why we're seeing those. Additionally, in areas where we might haven't seen yet, but we were expecting to see, it's also relevant information because now, for example, for endline, we know like that might be an area where we want to maybe do a little bit more qualitative research or even ask more questions. So this information is valuable in the sense of advancing in knowing how things are, but also is setting up, like is giving us some additional information for looking at the endline. And just to state that most of the variables where we see we have enough data and we had power calculations, there were some specific indicators, for example, child related variables, which we didn't include here, which we excluded precisely because we knew that we wouldn't have enough data. So I guess what comes out of this is like if we're doing a midline where we have a smaller sample, we probably need to be careful, and that's what we did. We need to be careful about which indicators to construct, and particularly if we know that we're going to be working with even a smaller sample, maybe those indicators are not that valuable to collect at midline. Attrition, and Rickson, probably there you can jump. The attrition was very small. That's what the exercise showed, which is kind of reassuring moving forward for the end line. But obviously, we still have a series of measures that we would take if we were to see higher levels of attrition at end line.
And maybe something we didn't mention on this presentation, because I think it complicates a lot of things, and we just wanted to focus on results. But what we discovered during the midline is that there's also a difference between, I think, public works and PDS, which was, I forget the name, but there are two types of clients, as CRS calls it. And so that was something that we discovered during the attrition exercises through our data collection firm. And that's something that I think we need to discuss further with BHA on how we're going to take this to the end line. But that can be a conversation for the coming months.
Oh, great. Thank you.
Okay,
And
thanks for raising that question yourself, Rigsum, and for your response, Miguel, to Jean-Paul's question. I know that we're quickly running out of time, and I've noticed Andy's comments here. If there are any, say, summary conclusive statements that you can share, Rigsum, and any recommendations coming from this midline study.
And Rickson, related to that, in the questions and answers, there is a question about if we can speak about how the implementer has used or plans to use findings to inform ongoing programming. I know that this was part of the conversation during contextualization workshop, so maybe if you can also mention something around that.
Yeah, so I can talk a bit about like how the implementer is using. So we had a very great workshop with them, and they asked us for like updated slides, information, whatever. And so they actually had their I think a learning event earlier, I think sometime around mid-September, where they used our findings to go over what needed to be done, what hasn't been done. Yeah, so they're using our findings directly to re-strategize their implementation plan.
Could you highlight possibly any specific areas or findings that were directly useful for that? Like what in particular was CRS finding was most informative to make changes in terms of findings?
Yeah, so I'll give you the example of this group-based savings, right? Like what they're saying is there should be no treatment effect and everyone should be getting it. But the fact that the control group here in the non-livelihood areas is lagging behind means that they need to focus more on the group formations in those areas. So that's one example I can give you right now. And then maybe on the wash, like they're quite happy with the boiling and bleach related interventions because whatever like the social behavioral campaigns that they're doing seem to be working, but they really need to focus on the market related interventions to make filtration and flocculation more available for the households starting next year. I think those are like just the two quick ones that I can think about, but I can follow up after after the presentation. In terms of conclusion, Miguel, I'm actually going to popcorn this to you since you are the PI, if that's okay.
Yeah, I can take that. So first, like the objectives, I think, of the midline were met in the sense of trying to understand how the reef side advancing. We see how important this livelihood differentiation is. As you might have remembered from the conversation, a lot of the effects that we are seeing in the livelihood area. So that definitely highlights how those areas are very important. There are specific areas where we see, for example, if we think about the finance part, savings is something that can be affected by the interventions, as we presented in the slides. But other areas, for example, like credit and insurance, are areas that even though they're implementing interventions, we're not seeing really much of an impact. That speaks obviously to a more complicated environment where actually credit and insurance is something that people in rural areas and poor people is more difficult for them to use. So that's also another area that I feel like, okay, savings is very important, but keep in mind that credit and insurance is not something that can be easily affected. Then also, I think like overall we see, and it's very encouraging to see like an impact in the food consumption score. And it's a very large impact, as I remember, is like around 20 percentage points. So that's also something that is going to be interesting for Endline to maybe try to dig a bit deeper on it and understand what is driving that. And that links maybe to another like conclusion for me, which is like, or conclusion, recommendation, and slash kind of like linking it to the Endline, which we're going to be doing next year. And is that a lot of these results that we're having here are giving us a lot of, at least me, I mean, I'm getting a lot of ideas of, okay, we need to maybe understand better, for example, food consumption score. How is it that the interventions are affecting? Because that's something that moving forward might be very important for BHA and for the country in general, in terms of saying like, okay, we're seeing that this specific pathway, these specific interventions might be very relevant for the area. So that's also something that we're taking a lot of these results and we're actually trying to design qualitative components for the Endline that allows us to better understand what is driving this, and that then it's gonna lead to more insightful recommendations. Maybe finally, and I think Jean-Paul, you mentioned it there in your comment, the context workshop was incredibly useful for us, because from the point of view of our research, we do very rigorous analysis, we come up with quantitative results, but many times, since we're not in the field, we cannot really say that as much as we would like to say about the interventions. Why are they working? Why are they not working? This context workshop, it was an effort to also incentivize the IPs to really work with us. We were able to understand a lot more about the interventions, and that's going to be very valuable moving forward for the end. So that's also another like kind of like recommendation or conclusion of how important it is that we work closely with the IPs to understand these results. And it's not just researchers, we come and we say this is what we see, but we talk with them and we understand with them. And in many cases, they guide us through, okay, why is it that they think they're seeing that? And then ideally, at the Endline, what we want to do is to design a qualitative component that helps us like even dig deeper around those insights that they might have.
Actually, I know Tom's ready to close this. I just wanted to add one little point. So I think when Miguel and I were discussing, like for us, the biggest takeaway was also how many of the households are not engaging in value chain activities. And from those who are engaging, they're still selecting into livestock. So maybe that's something that BHA and CRS needs to consider in terms of like how do you what needs to be done to get households to engage in some of the value chain activities? Like, is it because their food security needs are not met that they're not opting for income generating engagements? So I think that's, I don't know if it's a conclusion, but I think it's more of a recommendation that maybe that's something to think about.
Rickson, thank you very much, and no worries about the extra time needed. I appreciate you and Miguel taking that extra time to respond to these questions about how this information from the midline is being used. Obviously, it's been used already, but there's some open questions that you've pointed to that you don't have sufficient or at least adequate for your own purposes answers to. It'll be followed up in the Endline. So let me just say thanks for sharing what you have on the midline presentation findings. We will have the final report available very soon for those of you who are interested in looking at any of this in a bit more detail. But in the meantime, thank you very much for the presentation today, and thank you to all of you who've attended. Have a good rest of your day.
Thank you.